My name's Peter Schneider. I'm a vascular surgeon at the University of California at San Francisco, and I've been in practice there for the past 5 or 6 years. Prior to that, I was more than 25 in Hawaii, where I was the chief of vascular at the Kaiser Hospital in Honolulu. During that time, I've been interested in clinical trials. I've been interested in new techniques and technologies, such as we have with endovascular intervention. Even though I trained in the era when we primarily used open techniques, such as bypass, endarterectomy, through open exposures, and with typically excellent results, although very often those operations were of a larger magnitude than the patients could tolerate, because many of our patients, they're elderly, they have numerous other comorbid conditions that would put them in a situation of diminished health. And typically with open-only ideas, we would do major surgeries, and sometimes the patients would develop other new problems, such as myocardial infarction or pneumonia or kidney failure, because the operations were too big. So when catheter-based techniques, when it became apparent that those were going to grow, that those were going to become more sophisticated, I got very interested in that and started to develop those in my own lab, in my own hospital, in my own OR, and had pursued that since then, teaching and training in that, developing devices that are consistent with advancing the field, and also with the use of endovascular techniques to try to make a difference for patients that are quite sick in other ways, who have multiple comorbid conditions, especially elderly patients and those who have numerous other organ system problems. And I think, obviously I'm not the only one that has approached that, but we have approached it aggressively and energetically, and yet we still maintain our open surgical techniques. So one of the hallmarks of San Francisco is, and UC San Francisco, University of California, is that we actually still do a lot of open surgery. We do a number of hybrid procedures. It's not endovascular only. These are just a broad array of techniques that we try to use in order to, when I say try to use, that we plan a procedure or we offer a procedure to a patient, we try to tailor it to that patient. So one of the things I was interested in talking about with you is lower extremity revascularization. And I mentioned just a minute ago that I was interested in clinical trials, and we've had a number of clinical trials that have been done in the area of lower extremity revascularization in the past few years.